Dental implants are a terrific way to replace missing teeth. When a single tooth is missing, we have options for replacement. The preferred option, all things being equal, is a single tooth implant retained or implant anchored crown. The dental implant is placed in the gap, and then a crown is fabricated and attached. We consider this treatment of the space versus treatment of the neighboring teeth. The other option, the traditional method of replacement of a single tooth, is called a fixed bridge, where the teeth neighboring the gap are trimmed down to hold crowns, and then a middle tooth, a pontic, is connected to those two anchor crowns. We consider this treating the neighboring teeth to replace the missing tooth. If the bone anatomy where the tooth is missing is optimal, the implant retained crown is the treatment of choice in order to preserve the integrity of the neighboring teeth and to avoid connection of teeth, which can complicate oral hygiene and limit the patient's ability to clean. Of course, we can leave a space and not replace it, and for some patients this may be the safest way to go. We can also fabricate a removable appliance, a partial denture or retainer with a tooth on it, useful in most cases as a temporary solution, but in some cases it may be the preferred long-term solution.